Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello everyone, I am Dr. Amol Patil. I am an ENT and skull-based surgeon practicing in western suburb of Mumbai. I am attached to Nanavati Super Speciality Max Hospital as well. So today we are going to be talking about early signs and symptoms of vertigo. So many people who are later diagnosed with a vertigo don't realize what's happening at the first instance. So it may start with a very simple symptoms, easy ignorable symptoms like feeling slightly off balance, a brief sense of shifting of the room, blocked ear sensation, or sometimes a nausea which is without any other complaints. So these are very mild and vague symptoms. So you can blame this on stress or overexertion, sometimes a bad day. So you tend to ignore these symptoms. That's why we are here to tell you about the early warning signs which are often missed. Okay, so because these symptoms are very vague and they are very mild, many people tend to ignore them and relate them to the stress, a bad day, or overexertion, fatigue. In this episode, we will help you understand which are the early signs of vertigo and what pattern to look for when you seek help. So many people expect vertigo meaning a spinning sensation, but it doesn't always starts with that. So early symptoms may include a mild imbalance, a sense of nausea, earfulness, and unexplained by any other symptom. So these symptoms may come and go. So most of the people ignore these symptoms until they become more noticeable or they become more severe. So some people experience warning phase before the attack of the vertigo. We doctor call it as a prodrome. So as vertigo becomes clearer, it may usually have a certain pattern to it. And these patterns help doctor understand the cause of the vertigo. So one common pattern is a sudden spinning when you are turning in the bed, or you're looking up, you're looking down. So this is nothing but the positional vertigo, benign positional paroxysmal vertigo, which usually starts in the second and stays for a few seconds or a minute. So this typical condition is called as benign paroxysmal positional vertigo. Another pattern of the vertigo, which is a little bit longer lasting, which might last for an hours. Okay. So this will have patient with a difficulty in walking, a ringing sensation in the ear, earfulness, some degree of the hearing issue, and decrease in the hearing for some time. All these combined symptoms point towards the condition called as a Meniere's disease. So some people experience the attack of the vertigo after an episode of a viral infection. So this viral infection affecting your inner ear and giving rise to the vertigo is called as vestibular neuronitis. So these are the common signs and symptoms which points towards the different disease conditions. So not all the important symptoms feel like spinning. Nausea during the vertigo is a very common thing, and it can be because the brain receives a conflicting signals about the balance like motion sickness. So doctor may also look for abnormal eye movement, and these abnormal eye movements are called as nystagmus, and these help us to differentiate the vertigo, which might be because of the ear related condition or it's related to the brain. So many people feel extremely tired and extremely exhausted after the episode of the vertigo because it produces a extreme stress on your nervous system. So anxiety is also very common. After the repeated episodes, people may avoid a movements, feel worried about future attacks, and feel uncomfortable at the public spaces. So this is a natural response of a person and it's a part of the overall condition. So some people also experience oscillopsia. So oscillopsia is the condition where the visual world seems to bounce or move during the head motion. Before we finish, here are the three key takeaways from this small discussion. Vertigo can begin with a subtle warning signs like like imbalance, earfulness, or nausea. The pattern of the symptoms, like its duration, whether it's short, whether it's long, whether it's after the post infection, will help you understand the different causes of the vertigo. Symptoms like nausea, eye movement, anxiety, fatigue are important. So it is important to share the full picture with your doctor so that he can help you understand the vertigo better. So these are the small points which will help you in understanding the vertigo. Thank you very much for the patient listening. I hope this conversation has made you understand about the vertigo, early signs and symptoms.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.